Good morning, good afternoon, good evening, everyone listening to us around the globe. Today, we would explore together the journey that I embarked to develop a comic booklet about menstrual health and hygiene management for young women in Egypt. Please let me introduce myself briefly. I'm Fatma Barakat, a pharmacist by background and health promotion researcher and practitioner menstrual health advocate based in Egypt. So now let's explore together why menstrual health and hygiene management matters as issues of public health and human rights. Poorly managed menstrual health is a direct cause of morbidity and leads to adverse outcomes for adolescent girls and young women. If young females fail to manage their menstrual health and hygiene, their rights to health, work, education, and gender equality will be adversely affected. So where is the missing link? Menstrual health and hygiene management in Egypt is an overlooked public health issue surrounded by a culture of silence and stigma. Information is withheld by parents until the onset of menstruation. Girls lack the proper knowledge to practice menstrual health and hygiene management properly, and all of this together with a scant health education intervention to target this issue. Therefore, this project tries to fill in this gap by designing a culturally competent booklet that addresses this issue in Arabic. This project aimed to explore the experience of young Egyptian females at the onset of menarche, assess their informational needs regarding menstrual health management, and then finally design an audience-appropriate, culturally competent booklet in the Arabic language. So let's explore together the steps that I take to develop the comic booklet. First, a desk review about the previously developed material in African and Middle Eastern countries. Second step is that we conducted qualitative formative research to gain the target population insight about the comic booklet development, where we recruited participants from 14 governors across Egypt using purposive sampling, and we conducted 7 virtual focus group discussions, and then we analyzed the data thematically. Our formative research has yielded 3 main themes. The first one is about the experience of girls at the onset of menarche, where menstruation is perceived by Egyptian girls as a traumatic experience characterized by fear and distress. The second one is about the menstrual health literacy level, where most girls depend on word of mouth to learn about how to manage their menstrual health in the absence of formal education. And the last one is about barriers to seek care for menstrual health related complaints, where most unmarried girls are denied access to care due to the negative socio-cultural norms. The third step in the development of the comic booklet was using a storytelling approach to provide the essential information in Arabic language. The developed booklet was tested for acceptability, cultural competency, and comprehensibility through focus group discussion and was revised accordingly. To make sure that the project was ethically conducted, ethical approval was obtained from the Institutional Review Board at AUP, and online informed consent was obtained from the participant, and to give back to the girls were provided with free access to 1-hour health awareness webinar about menstrual health and hygiene management. Before we conclude our talk today, let's take a look about the public health implication of this project, both for research and for the community, because it adds to the research database about menstrual health and hygiene management in the Egyptian context. Developing this booklet to address menstrual health and hygiene management has huge benefit for the community, including normalized discourse about menstruation, debunk misconceptions, promote positive social norms, and reduce the stigma around seeking health care for menstruation-related symptoms. Last but not the least, thanks are due to the Department of Health Promotion Community Health at the Faculty of Health Sciences of the American University Beirut for their ongoing support throughout the project duration. Thank you for your attention listening.